Can you explain why this radiological test is so important that every hospital have at least one separate zone which is dedicated for imaging?
Priority is mainly about radiation safety.
Fear about the radiation. So the question is, sir, is it really radiation is harmful?
The people or the patients and their attenders are actually lacking the basic knowledge regarding radiation.
Ionizing radiation is harmful. Okay, because of that, we should be more careful about that. So we will be having a X-ray and CT in a separate zone, as well as ultrasound and MRI will be in a separate compartment in the radiology department itself.
The human is designed in such a way that the most of the delicate part is inside our body. So for generally for seeing the body parts, like the surgeons dissect the body. But it is truly fascinating that these radiations are able to expose the internal part. But how it is happening, sir? How X-rays are able to show the internal parts?
So when X-rays are interact with the patient body, it will undergo attenuation. So attenuation generally it will depend on the
The modern time, we have another department which is, I think it is a more good than the radiology. If I am wrong, then you can correct her, and that is called as a nuclear medicine. So what is nuclear medicine and why patients have to undergo it, sir?
CT will give a proper anatomical nature and PET scan will give a proper functional status. When both are combined, I can able to diagnose easily. It will be good for our doctors to evaluate the pathology easily.
Current research is going in the field of radiology.
A means artificial intelligence. It is mostly involved with cancer imaging as well as how to implement in the modality basis as well as the post-processing nature. Okay.
Actually, I have myself has kept it. You pose, we expose.
You pose, we expose. Amazing. Hello friends, it's a pleasure to have you back on the channel of Clinical Care Inside. Today we are going to discuss about the nuclear medicine and radiology. Today we have the distinguished guest who is expert from their field. The first one is Mr. Mumim sir. He is currently working at Saptagiri Medical Institute and Research Center. Another guest we have is Morgan sir. He is Kasim Morgan sir. He is currently working at the East Point Medical College and he is also working as an assistant professor. As we all know that every hospital have the one separate zone which is basically dedicated for the CT scan, MRI, ultrasound and other radiological tests. Okay, and there are so many misconceptions, myth about the scanning procedures, that is it harmful. Okay, so we will talk about all these things in our today's podcast. So sir, first I will start with the Kasi sir. So my first question is, can you explain why this radiological test is so important that every hospital have at least one separate zone which is dedicated for imaging?
So it is priority is mainly about radiation safety. Okay, so safety is matter. So only those who want to get involved in the diagnostic procedure, they only should be present in that area. Okay, so apart from that, those who coming with a patient attender, they should not be get exposed to the radiation. So first of all, that is one thing, reason radiation zone is separate, and we'll be having a restricted zone. We'll be calling it as a restriction zone because it is harmful. Okay, then according to the infrastructure wise, we are following the ARB guidelines that we should have a separate zone in the basement. Most priority will be in basement, so that nearby, so general public or more crowded people should not be present in that area because of radiation. Okay, so even though we'll be doing like inside the X-ray room with a proper shielding, proper technique we are following, there will be background radiation will be present in the department. So that's why most of the time that only patients will be allowed inside the X-ray room, others will not be allowed. Okay, that is the one thing. Apart from that, so if you consider, we can divide into two types of radiation. So ionizing radiation as well as non-ionizing radiation. X-ray, CT will comes under ionizing radiation. So CT and MRI and ultrasound will comes under non-ionizing radiation. So which is separated. Okay. So ionizing radiation is harmful. Okay. Because of that, we should be more careful about that. So we'll be having a X-ray and CT in a separate zone, as well as ultrasound and MRI will be in a separate compartment in the radiology department itself. Okay. So ultrasound is basically because of sound waves, it will not be harmful. MRI also not a harmful thing. Okay, there will be having a separate types of zoning system. Okay, generally ultrasound not required zoning system, whereas MRI required. It is because of the magnetic field. So we'll be have a separate screening. Okay, then this is about safety aspect. So then about infrastructure, as a hospital, if you want to renovate anything you want to do with the radiology department, nowadays radiology innovation is happening. We want to get advanced machine for easily shifting. It is not a easy thing. So machines are huge. Okay, that it will be huge in weight. We can't lift to first floor or second floor. That's why when it is having a basement, so easily we can adapt and we can able to shift and we can able to renovate the department easily. So this is what we will be having this thing. So for shorten term we want to give means it is about radiation safety. So those who are need, only those patients should come under radiation zone, others will be in the restricted way. Okay.
Okay, so you are saying, sir, why all hospital have the separate zone? Just because of first is ready from the radiation safety, another is for renovation purpose.
Renovation purpose.
Okay,
And as well as it is based on ARB guidelines.
ARB guidelines. Then, sir, the safety words comes whenever we talk about the radiations or the radiological scans. There is a safety word, and most of the person who are going to take this radiology scans, they have one like fear about the radiation. So the question is, sir, is it really radiation is harmful, or every patient who is going to for the scanning, they have the chances to have the radiation exposure, which can damage their body?
So actually, the people or the patients and their attenders are actually lacking the basic knowledge regarding radiation. For patient, it is not harmful at all. I'll just declare this today. For patients or the attenders, those who are coming for radiological scans, it's not harmful at all. There is zero harmfulness. Okay, zero harmfulness, we can say. Instead, it is very useful for the patients, okay, and for the other departments except radiology. Now, why I included radiology in harmfulness is, if we don't follow the protocol, if we don't follow the preventive measures, if we don't follow the precautions that has been already told by our regulatory board, that we should follow certain protocols, we should follow certain preventive measures, so that the workers or the persons working in the radiological department will not get the problems or will not face the problems because of radiation. So for patients, I'll declare it today, and we should remember it through your podcast. I'll try to mention a point. I will try to highlight a point that it's not harmful for the patients at all and the attenders, unless and until the patients are exposed more than they need to get that exposure. Okay, actually, for example, if you are a patient, I'll ask the, just try to make you understand, and the persons who are watching your podcast, if you are a patient, you're coming for a radiological scan, let me tell you only how many times a year or a month will you come for the radiological scan, for an x-ray or for a CT maximum. It depends on the health, it depends on the condition, but maximum how many times you'll come for the scan? Two 3 times a month, or maximum 10 times a year. So there is no harmfulness in that. There is no harmful, because how much radiation dose will you see? There are certain dose limiters that is not recommended for patient at all. It's for the workers who are working in that department, like 20 millisieverts a year. Minimum dosage limit, maximum is 30 millisieverts or 100 millisieverts for a patient. So if it exceeds that dose limits, then the person or the worker is in danger. It will never go beyond that. It will never. So radiation is not harmful at all.
Radiation is not harmful.
No,
Because we
especially for the patients.
because as a radiographer, you have the taking care the measures, all the safety measures.
We have preventive measures. We have the equipment that will protect us. In that, we have a lot of lead products. Especially, we have primary protection that will protect us from scattered radiation. We have secondary protections. We have primary protections. Then we have, over that, we have certain lead products like lead apron, lead glasses, lead shoes, lead capes, thyroid shield, that all the gonad shields, that all we have that will protect us from scattered radiation. That because a worker in the department of radiology is more prone to scattered radiation compared to primary radiation, because primary radiation is for patient. The scattered radiation is the radiation that comes back, that is scattered from the patient towards the person who is exposing, or towards the worker, towards the radiographer. He is more prone to the harmfulness of the scattered radiation. So for to protect ourselves, we have a lot of protective measures there. Okay, so it's not harmful at all for patients.
So basically the radiological scans are not a harmful. Okay. And sir, the another thing, for seeing the internal organs, like human is designed in such a way that the most of the delicate part is inside our body. So for generally for seeing the body parts, the surgeons dissect the body. But it is truly fascinating that these radiations are able to expose the internal parts. But how it is happening, sir? How X-rays are able to show the internal parts?
So when X-rays are interact with the patient body, it will undergoes attenuation. So attenuation generally it will depend on the atomic number, density and thickness. So when attenuation will be more when density is more. So as well as when atomic number is more, attenuation will be more. As well as thickness is more, attenuation will be more. Okay. When density is less, vice versa. Okay, attenuation will be less. So whichever having attenuation less, it will be appear like black in image, X-ray image. Whichever having a more attenuation, it will appear bright in manner. So I want to state means it will be appear like white color. Okay, so when you take X-ray image, if you generally see, bone will be appear as white, lungs part or air part will be appear like black color. Generally our lungs is composed of air, because of that it is have a less density, because of that it will appear as black in nature. So bones have a high atomic number, as well as it is density also it is high, because of that X-rays will be attenuated more, so that we can able to visualize the anatomy. This is was the basic principle behind the X-ray image, how it is coming. Okay, so this is what about the basic general physics about how we are able to visualize the human body through X-rays.
X-rays. Means basically you are saying that when we are giving the exposure of the radiations, it goes inside and it will generate the image based on the density.
It is based on the absorption.
Attenuation
Attenuation
means
means
absorption.
So absorption will takes place. Okay, so attenuation in the sense absorption will takes place. It will be based on the three things: atomic number, density and thickness of the patient. Okay, thickness of the material which we are having. So in our human body, we want to say means bones, muscles and air, so water, so which will have a various density also. Based on the density, absorption will takes place. Okay, so when it is high density, we'll have a more absorption, which will appear bright on the image. When which you have a less density, it will be appear black in nature. So these with combination of two difference in the image, it will produce the anatomical structure. Okay, if you ask about liver, means it is density is lesser than bone, it will appear in a gray manner. Okay, so generally X-rays when interact with the body, based on the density, atomic number and thickness, great shades of image will be produced. That only we are visualizing as a anatomy.
Okay, sir. I mean, there is a science behind this radiation. But for a general people, like we are seeing the X-ray film as a black and white. I mean,
That's what sir was explaining.
black and white plastic sheet. But as a radiographer, how you are seeing actually, like what you are looking inside this film, radiographic film?
See, when a patient undergoes X-ray, and when we process that X-ray and give it as a print that image on a film. Okay, that film itself is either it will be in light blue color or it will be blackish in color, that X-ray film. So when we print the image on that usually I have seen when we dispatch the film to the patient or attendant, what they will do, they'll take out the film and they look like this. I don't know what they will see there. Mostly the fractures, the major fractures will be clearly seen. You can also visualize.
Yes, sir.
So fractures you can easily see. But going for as chest X-rays are commonly employed in radiology. So talking about chest PA, posterior tendon, which is commonly employed for lung pathology or the disease related to your chest. Okay, or a pulmo. That is the thing is there. Even I'll tell you, being a radiographer, sometimes I'm not able to rule out what the issue or what the pathology patient is having. Pathology means what the problem patient is having, what the disease problem. Because we have a separate we need a separate degree. That is like we need to do first MBBS. After that, we need to do PG, post graduation in radiology. And then once a person becomes a radiologist, he only is able to rule out the entire pathology. But because sometimes it will be very minute pathologies patient will be having. Okay, and because chest pain, there are a lot of reasons for these X-rays. See, commonly X-rays will be done for chest X-rays will be done for, first of all, commonly cough, vomiting. Sometimes it will be like breathing issues. Breathing issues are common. Breathing issues. So some of our patients will not, they'll commonly see the film because they just normally they will see and they will just point out, hey, this, because they don't know anything. Yes, Sarah explained that in that you will see, you told you'll see black and white parts only. See, like talking about chest X-ray, it's present in the thoracic cage, so it's covered by ribs. It's covered by ribs. Inside there are lungs. So inside lungs, what is there is ear. So ear will come as black. That what we discussed. Why ribs will come gray or white? Because of density and all those factors. Okay, because that's bony cage. So that's why it appears black and white on the image. Ear black, bones white, and other soft tissues they will appear as gray. So that's what you see, but we see a different aspect because we know we have studied for last 4 years and we are working in that department. Every day we'll get new cases, and we have our head of departments, we have doctors there that will be this explaining these things, like this person is having pneumonia, this person is having pneumothorax, this person is suffering from other pulmonary diseases and all. So for you it might be white and black images, but for us it's a different aspect.
I mean, there is a meaning behind those black and white papers.
And those common people cannot rule out. I'll tell you that. Common people cannot rule out. It needs a special degree for that.
It needs a special degree.
So I want to state one more thing. So when you take X-ray, so we as a doctors knows that normal anatomy looks in a this way. Okay, normal anatomy should like this. Apart from that, any difference they are noting down, it is related to the pathology, and each pathology will have a different thing, different appearance and signs will be there. So based on the signs and appearance, doctors will evaluate the pathology and they will. So as a radiographer, we have no role in diagnosing the pathology. Our role is to produce the high quality images. Okay. So even though we know about the pathology, we should not declare it. Okay, we are not authorized persons.
But generally, sir, like patients comes and asks, no, that is any severe problem.
Yeah. So as a radiographer, we know about that there is a abnormality is there in the image. But as a radiographer, we should not disclose that. Okay, we are not an authorized person. Authorized person only doctors can. Those who doubt MD radiology, they are only eligible to
Tell the diagnosis.
declare the diagnosis, whatever it is. Okay, so mainly those who are working in the field, they should not, even though we know.
Okay. And sir, like for prescribing the medicines, we are varying the dose according to the age, according to the gender. We are varying the dose. And what about the radiation dose? You are varying the dose for the children or for pregnant women?
So first of all, pediatric patient, we have to reduce the dose. It is for patient protection, radiation safety aspect only. So if patient thickness body is less, so I can produce a image, high quality image with a low dose. Okay, first thing. So second thing is, so pediatric patients are radio sensitive in nature, so that they are in developing phase. So they will, if you interact with the radiation, there causes cell mutation, cell division. Due to that, they will have an abnormality. Because of that, we have to reduce the patient dose.
Okay. And sir, what about the pregnancy?
Actually, for pregnant ladies, we should not expose at all. Now, if it comes to like, it's compulsory to expose the patient. We should take all the preventive measures. Like, for example, if the pregnant lady he had a fracture, he had an accident, and he had a fracture in her hand. Okay, so what we will do, we'll protect her entire body except her hand. Okay, we'll protect her, and we have the lead shieldings, we have lead aprons, we have thyroid shields and other lead capes, lead goggles. So we'll protect her entirely. So what we need is, we need an hand X-ray of that patient. That too, when a doctor or the department head recommends that X-ray. Actually, if a pregnant lady comes to your department, immediately you should inform to the in charge, to the head of the department, and you should dispatch that patient from the department. If it's like for common X-rays, but if it is an emergency, like the patient had an accident or patient had a fall, and patient is having a fracture in her hand, or in her lower limbs. So now we need to expose. To rule out the fracture, we need to expose. We have to see the fracture, and maybe patient will undergo surgery or any other procedure. So then what we will do, if an hand X-ray is required for the pregnant lady, so what we will do, we will only expose hand, that we are commonly doing. Rest of the parts we will cover with lead equipments, and we will follow some rules also, especially followed for all the, every time we'll follow in this we'll follow that ARB regulations. Okay, we will keep the dose as low as minimum, means we'll minimize the dose. For example, if commonly we are giving a factor like we have KVP and MES factors in that, if we are commonly giving 60 or 55 and 8 for hand, we will reduce it. We'll reduce it little more. Even though we will not get good quality images or better quality images, we will reduce it. We'll just while processing, we will try to adjust the contrast nicely. But here we will reduce. And another thing is we'll cover her entire body except the anatomy which is required for the X-ray. Okay. So first of all, I again come to the point. For pregnant ladies, we should not give the exposure. In case of emergency and all, we should take all the preventive measures for her. Okay, so that the baby who is growing inside should be safe from mutations or from other harmful.
Means,
I will also state on
yes, sir.
generally people will have a afraid when pregnancy is there, they can undergo X-ray examination or not. So that time, as a thing, in first trimester, there are high risk possibilities are there. In first trimester, compulsory they should not undergo any examination. Trimester, because that is the development stage, that cell division everything will takes place. When primary radiation interact with that, definitely that patient baby will have anomalies. Okay, so even when it comes to second and trimester, they want to undergo any radiation examination apart from the abdominal area. So as Momin said, so we can undergo with the basic protection, everything as a following. Okay, so and always we have to assess that benefit versus risk factor. Okay, so when mother is in risk stage, so we should undergo compulsory examination. Okay, as well as, so when baby, that time baby is not important, patient life is important, so that time definitely we can undergo for the procedures. So this is what I can state.
Means basically in pregnancy, unless until there is no any really the emergency, we should avoid.
So we should avoid the radiation. Alternative things are there, they can go undergo ultrasound examination, they can undergo MRI examination also. Risk factors are there. There the children will, because MRI will be having a heavy noise inside the MRI. So nowadays we have a silent MRI, they can opt that and they can go. So if generally there is a fracture in finger, hand, like that, means as Momin said, we can undergo examination by taking care of proper precaution.
What we are seeing in MRI or in the ultrasound.
So ultrasound, we can able to image the patient anatomy only. So it will appear as a gray and shader only. So in X-rays we are sending the radiation. So whereas in ultrasound we'll be sending the sound waves. Through that sound waves, I will generate the image and I will able to visualize what anatomy is present inside our body, pathological wise also. Okay. In MRI, I'll be sending based on the magnetic resonance principle. So we'll be having a magnet as well as we'll be having a RF pulse. Okay. So when both are interacting, there will be a MRI is non-ionizing. So where we'll be with the help of magnetic field, we'll do the imaging. Okay.
And sir, if you're talking about the accuracy, then X-ray is more accurate or MRI or this ultrasound is more accurate?
Accuracy wise, I can tell you both are having their advantages. Like if you want entirely see in
If it is any specific indication for this thing.
for X-rays, like you cannot rule out a fracture, as I'm correct. You cannot rule out a fracture in ultrasound but soft tissue pathologies you can rule out. Pathologies related to your abdomen, like if you have abdominal pain or any infection, any abnormal growth in your abdomen or in soft tissue anatomy, you can rule out very nicely and very easily in ultrasound compared to X-rays. In X-rays, you cannot rule out this what I will said soft tissue pathology very nicely, but compared to that, you can bone cage pathology you can easily rule out, like fractures, dislocations, calcification, Okay, for example, I'll tell you, if a patient comes with abdominal pain, we will do both X-ray as well as ultrasound. First, the patient will go undergo X-ray only. So in X-ray, if it's not clear, if the pathology is not clear, if the cause is not clear, why the patient is having so severe pain, second, compulsory and mandatory, he will go under an ultrasound scan. There, it will be ruled out very nicely why patient is facing a severe pain. So for soft tissue pathology or the pathology which is related to your soft tissues like liver, stomach, gallbladder, pancreas, etc., ultrasound is most appropriate. And for pathologies related to your bony cage, related to your bones, it is good to go for X-rays.
Okay, sir. And sir, in modern like in the modern time, we have another department which is, I think it is a more good than the radiology. If I am wrong, then you can correct it, and that is called as the nuclear medicine. So what is nuclear medicine and why patients have to undergo it, sir?
So if you want to make a difference between radiology as well as nuclear medicine, means radiology is anatomical oriented and it is a diagnostic aspect. So whereas nuclear medicine is physiological, we can know the physiology of our anatomy, as well as it is also therapeutic in nature. Therapeutic means it will involve in a curable nature. Whereas whereas X-ray, CT they are undergoing means it is only basic diagnostic. So only we can say it is what pathology is there. So there is no, we will not give any treatment through X-rays or CT or MRI or ultrasound. So only that is in diagnostic manner. This is therapeutic. Therapeutic means which involve in curable also. Okay. So nuclear medicine, basically which patient will undergo means cancer patient they will undergo. So will cancer patient first they will undergo CT, they will identify cancer is there. So if they undergo with a nuclear medicine, they can go particularly how much area is involved, whether early stage of cancer can be predicted in the nuclear medicine. So generally what we'll do means how we'll image in nuclear medicine means we'll inject the radio pharmaceutical, that is a isotope content will be there. So if I want to tell means fluorodeoxyglucose 18 ftg will tell that material will be using for the injecting. So when we inject, so what will happen where cancer cells are there this radiopharmaceutical material that medicine will accumulate more, because cancer will have need of more amount of energy, that basically energy means glucose. So that part, so there will be more accumulation of radiopharmaceutical will be there. So based on that, I can able to evaluate there is a cancer cells are there and how much area it is spreaded, whether metastasis is there or not, I can able to identify easily. Okay. So this is nuclear medicine once comes, it will be a whole body imaging. Okay. Anytime doing a whole body imaging, I can able to image where and all cancer cells are present. So when it comes to CT, if you same patient if you are doing in the CT, so step by step I have to do. I have to do chest separately, I have to do abdomen separately, I have to do the lower limb separately. So it is comparatively costly when comes to CT. So whereas around 20,000 cost it is nowadays, it is there for nuclear medicine scan. Within 27 I can able to image whole body image. I can able to accurately tell where and all cancer spread is there, how much area is involved, and mainly I will know physiological nature. That is
Means basically the difference between the radiology and the nuclear medicine is that nuclear medicine give the functional aspect of organ, a pathological organ, and you are using the isotopes, which is mimicking like the glucose, making like a glucose, and wherever they are accumulated, and you are capturing those area and understanding the tumor activity, the cancer's activity. That's amazing, sir. And every aspect of the radiology and nuclear medicines is like really fascinating me. Although I'm not in that branch, but like it's like great that because you are able to see the internal parts of the organs, and it will allow a physician to direct a proper medicines. If we are not seeing any inside organs part, and if I prescribe the medicine, it's like a blank. But if there is an image, and if we are properly seeing that image, then the treatment is also accurate. But the one part is like a bit saddens me, sir, and that is the price. That as we want more clarity, the price is increasing. Why it is, sir?
Because the modalities itself are costly. The modalities which are using in radiology, like X-rays, X-ray modalities, X-ray machines, I can say, to simplify it for your For the persons watching this podcast, let me not use the term modalities, let me use the term machines. X-ray machines is there, CT machine is there, MRI machine is there, even the ultrasound scanning equipments. So all these are very costly, and there is very high maintenance cost for these machines. So I'll tell the difference. For example, if one of my colleagues is from laboratory side, medical laboratory department side, so if he wants to set up a lab, he can set up in just few lakhs. Like I can say in 3 lakhs, he can bring up the machines, use it for certain tests, CBC or platelet count or any other test. So he can set up a lab within 3 lakhs. If we, the radiological persons, have to set up a lab, minimum if we will just employ an X-ray machine, it will take minimum 10 to 12 lakhs minimum. So the modalities itself are costly. Second thing is the maintenance cost of all these modalities are very costly because you need a separate engineer that is called as biomedical engineer. You need a biomedical engineer. If there is any technical issue with these machines, you cannot call a normal person to correct that technical issue, like a technician, normal technician, like a normal engineer. Okay, you need a separate biomedical engineer who has pursued a separate degree in this field. He only can rule out the issues, technical issues with the machines. So that's why the maintenance cost is very high. Plus, the modalities itself are very costly, and mostly these modalities are imported. Most of the modalities are imported from foreign countries. That's why it becomes very, very costly for us here, and that's why the radiological scans and the tests are costly. This is one of the reasons. But I can just point out, if our government interferes, the cost is, or it might become cheaper if the government interferes in these things, or the hospitals itself can cut out some costs, it might become cheaper. But you cannot expect the means it as with the cheapest scans in the department or cheapest testers in the department. So it will be still be costly compared to other tests and other scans.
Means like why these tests are price like more price just because of their maintenance.
Modality is maintenance cost and the modality is cost itself. See, I'll tell you one more thing. MRI, normal MRI. So it's simply if you go for a normal MRI modality, which is commonly employed now, we are using 1.5 Tesla. We have higher than that also. But if you go for common, that is 1.5 Tesla, it will commonly minimum. If you go for a new modality, minimum it is like 5 crores. Different depends on different companies. We have Philips, we have Siemens, okay, we have GE, we have different modality companies. So minimum 5 crores, 4 crores, 6 crores. So that you see the modality cost. So after that, if a person or if a businessman buys, or if a hospital who's running a hospital, if he buys an MRI scanning machine, okay, then at such a huge cost, he will not keep the scans at a cheaper rate. Now he has to keep it at higher rate. And around the market, if you see around in this hospitality market, you will see this almost there will be little variation in the costs. Like if a Saptagiri takes like 3,000 for an MRI, normal MRI scan, outside hospital will take 3,500 or 2,500, like that. There will not be much, but mostly the scans will be costly
This is costly because of their.
because of the maintenance cost and because of the cost of the machine modalities.
And sir, what about the aspect? What is aspect, sir?
Spectre PET.
PET and aspect test. Yes, sir.
PET scans or positron emission tomography. It is a modality where it will be functional with the nuclear medicine. So where we used to capture the images. Okay. So generally PET is there means mostly involved with cancer imaging, and we'll combine with the CT also. That we'll call it as PET CT. It is a hybrid imaging. So when PET imaging, if you are taking, only we can see the physiological functional manner. There will be a degradation in the image quality of PET. When it is compared with the CT, so we can get the anatomical detail as well as physiological detail in a same way. That is what PET CT. So which will be useful in the cancer imaging. So which will give a good diagnostic value, and easily doctors can diagnose the pathology and disease.
So basically, mainly for the cancer tumor activity.
Cancer imaging, it will be PET scans will be generally used for cancer imaging. So which will give the functional aspect, as already told in the nuclear medicine category. So as well as it will have a image quality will be degraded, organs everything we can't see clearly. So I told when cancer is there, where glucose uptake is more, their radiopharmaceutical will accumulate. So their image quality and resolution will be very poor in nature. So I can say, suppose it is in the right hypochondrium region, means I know liver it is there, but exactly liver which segment is involved, where it is involved, I want to know, means I have to combine with the anatomical. So which CT will give a proper anatomical nature and PET scan will give a proper functional status. When both are combined, I can able to diagnose easily. It will be good for our doctors to evaluate the pathology easily. That is what PET and PET CT. Mostly it will be called as hybrid imaging.
Now I am understanding, sir, why why cancer treatment is so expensive. The one hand is the tests, the scans. Now, sir, both you are working in the multi-specialty hospital. What cases generally you day to day seeing inside your workspace? Commonly.
So if I talk about X-rays, the commonly cases will be like chest X-rays to rule out any pathology, lung pathology, or going if a patient is going for surgery, we need to do a pre-op X-ray. That is chest X-ray to see. So that's commonly employed for pre-op cases, the surgery cases. Second is fractures, like there will be road traffic accidents, there will be cell fall, or sometimes persons will be having some persons will just indulge in a fight, and there will be, or normally if you are walking through the stairs you will just twist your ankle or your foot. So these are the common cases most commonly. For example, I'll tell you like this. I'm working as a radiographer in Saptagiri multi-specialty hospital. If in total at the end of the day we'll take the count how many x-rays in done today. So you average x-rays are like 110 120 x-rays.
110.
That's common. One
Not a normal number, sir. It's a huge number.
it's very less in Saptagiri. Compute to Manipal and all. If you compute to Manipal and hospitals that are like international level or like very famous hospitals, reputed hospitals, there the number becomes very high. This is
You are alone working there, or you have the
no 9 technicians. Currently, we are 9 technicians working in three shifts. 3 shifts were working 9 to 5. One technician cannot take so much patients or cannot work for a longer period of time. We need breaks. We need to take rest. Okay, and we need to have take care of other things also. So the thing is here I'm talking about. See, commonly I'll tell you one thing: 110 X-rays, 120 X-rays. Out of that, I can assure you, 60 X-rays will be chest. Out of 110, 120 X-rays, 50%, 40 to 50% to up to 60% X-rays will be chest only. That are the common X-rays which are coming for us. And second is fractures and all. That will be second part. CT, we will have commonly employed CTs are CT brain. CT brain. CT brain. Mostly CT brain, along with that abdomen. Abdominal scans in CT. In MRI, we also have same MRI brain or the common MRI brain. Along with that, we have spine. MRI, whole spine will be there. MRI lumbar spine will be there. To see any intervertebral discs or to see any disc bulge, we will go for MRI scan. So in X-rays, we will have commonly chest X-rays. Second is X-rays related to the fractures. In CT, we will have CT brain, CT abdomen, and in MRI, we will have MRI brain along with that MRI spine. So these are
most cases for the chest, respiratory illness, and another is like fractures and CT brain.
And you'll get special cases also. There are certain special X-rays, certain special cases that will also come, but that are very rare, very rare.
Thank God that's are rare. Now, sir, another thing you tell me about the research, because like the medical science is ongoing, the research is ongoing in this field. I think this is the one branch where the research is extensive. So what's current research is going in the field of radiology?
A is the most developing research development is happening. A means artificial intelligence. It is mostly involved with cancer imaging, as well as how to implement in the modality basis, as well as the post processing nature. Okay, so that radiographers will be working with the engineers, that coding engineers, and developments are processing, and it is in a research state. Another 10 years it may come into a effective manner. So what this research are doing means to give a proper treatment plan, as well as to detect the pathology in an accurate manner. Okay, so if you take any radiology report suggestive of this pathology, suggestive of like this, they will tell that suggestive term will eliminate when it comes to a. Okay, and they will
More accurate, like the
more
definite
accuracy,
diagnosis.
more accuracy we can get it with the help of AI technology. So AI will not replace any doctors or anybody. With the help of AI, we can give a proper, accurate treatment as well as accurate diagnosis. That is what research is going on. Another 10 years, it may be more effective, 10 or 15 years.
What amazing thing. And sir, if someone wants to pursue the career in this field as a radiographer, then what he have to undergo?
He has to undergo a lot of things. So basically, like first of all, he should be from a medical background. Like in his +1, +2, he should be having subjects like physics, chemistry, biology compulsory, that are mandatory, along with like whatever the minimum percentage that university will keep for that, whatever the requirements are from that university. So second is, he has to choose the career of radiology, so he has to pursue a bachelor's in the radiological field. For that, like course, it will depend on different universities in different states or in different countries. There are different year limits for this. So as I have pursued my bachelor's from Rajiv Gandhi University, so it was like 3 years theoretical and 1 year internship, mandatory rotational internship was there. So first year it was basic subject like anatomy, physiology, pathology, whatever nursing people and all other departments are studying. So anatomy, physiology, then we have biochemistry, pathology, and microbiology. That was the first year subject. In that, anatomy and pathology is very important for radiological students. Like in second year, the subjects are entirely different. We go towards medical physics, radiation physics, okay, procedures, positioning, and all. And in third year, it's like MRI, CT, okay, MRI, CT, ultrasound, nuclear medicine, and all. So if a student wants to be a good radiographer, if he wants to be seriously, he wants to be a good radiographer who wants to have a bright future and a secure future, I will recommend him that his first year anatomy and physiology should be very strong. He should study anatomy in very detail, and he should study pathology in detail also. That's what I will recommend for him. And he in any field, whatever you course, for example, you are from the nursing background, you should also work hard in your field to be a good nurse. Okay, same for radiological students. He should be a he has to hard work. It's must for him to work hard, and I'll say technically also, and theoretically also, and practically also, he should be strong in all these zones. Theoretically, in first year, see, there are actually in first year there are no postings, no clinical postings at all. So theoretically, he should be strong there. His anatomy should be strong. Like if there are 206 bones, if there are 639 muscles, he should know all the anatomy entirely. I will say he should know all the anatomy, all the joints, all the bones, all the muscles, even the nerve supply. It's not like doctors should study or other departments who are entirely dependent on anatomical subjects and all. But I'll tell you, radiological people, their anatomy should be very strong. Or the students pursuing a bachelor's in radiology, their anatomy should be strong. Plus, their pathology should be very strong. And other subjects, they should have knowledge, basic knowledge of those subjects also. But anatomy and pathology is very important for these students. Along with that, physics, what are that are related to our department, only medical physics, radiation physics, this should be very clear to them. So then only they can become a good radiographer. And along with that, they have to work in the department in their clinical postings. And I mentioned 1 year rotational internship is there. Rotational internship means they have to spend time in X-ray also, some months in X-ray, some months in CT, some months in MRI, ultrasound. And along with that, maybe you are not familiar with this, we are employing in OTs also. There is a machine, portable machine in OT, that's known as SIAM. So whenever any surgery is going on, for example, I'll talk about orthopedic surgery. If a person has a fracture, X-ray is done, a fracture is rolled out, he's having a fracture in his lower limb. Now he has to undergo surgery. They'll put a plate, they'll put an implant in it. So while putting the implant, whether the implant has been implanted correctly, it has been put correctly or not, the doctors during the surgery only, there will be a
Using one machine like band.
it will be in C shape.
I seen, sir.
There's two arms, it will be in C shape. You have already seen that during your postings or in hospitals. So that is also costly. Talking about so there during the procedures only, that will give continuous images. For some seconds it will give continuous images. Or if you have worked in urology OT, there they will do PCNL procedures. Okay, PCNL procedures they will do. So during that, when that wire is going inside now, so whether it is going correctly, whether it has reached the correct part, correct anatomy, that time also CM will be used. So along with that, we have one more department, cath lab. It comes under cardiology, but there also we will employ, that is known as cath lab. So for angiography procedures, for procedures related to your this vessels and all, there we will have one more, that is cath lab. So we are not only operating in the department, we are operating outside of the department also, that is in OTs and cath labs.
And sir, being a radiographer, we have to pursue first the BSc degree.
First a BSc, bachelor's in radiology. Bachelor's in radiology. After that, we have to work. We should be clinically very strong. Within 3 years, we should be theoretically very strong, and after 3 years, we should be clinically very strong.
There are some patient who is under control. I mean, you can scan them gently, but there are certain patients like the psychiatric patients. How you are managing their scanning?
So generally psychiatric person, they will not cooperate, as we know. So we'll undergo for sedation. So doctors will give a sedation. In sedation manner, we'll take the scans. Still they are not cooperative, means we can't carry out the procedure, and we'll opt for an alternative diagnostic pattern. Okay. So in sedative manner, we can do the scan. That's not a major
Sedation.
sedation. So like psychiatrists, then claustrophobia will be there. Claustrophobia means fear will be there. Those patients we can undergo with the sedatives.
Sedative drugs.
Sir mentioned if you like psychiatry patient comes, so we can give sedation for them. If a psychiatry patient is undergoing CT scan or MRI scan, we can give sedation. Like another thing is, for example, if a patient like he's having multiple fractures, he had a accident, he met an accident, he's having multiple fractures, like he's having fractures in his lower limb, he's having fractures in his upper limbs also. So when you touch the patient, when you hold the patient, he will just shout or he will cry. So that time what you have to do is you have to deal very delicately with the patient. Okay, you have to call patient attender. You have to, first of all, what you should do, you should make patient comfortable. Even in that situation, you should make patient comfortable. You should explain the procedure to the patient, whether it's an X-ray, it's a CT, or it's an MRI. Okay, for X-rays, you should very nicely, the communication skills should, for a radiographer, the communication skills are very must. The communication skills should be very nice and high. So what you should do, you should first console the patient. You should first make the patient comfortable that this is a scan which is very which is really required for you, which is really needful for you. So you should please cooperate for 2 minutes. It will just take 2 minutes. It will just take 1 minute, or it will just take some few seconds to do this scan. So you please cooperate. And how much, for example, if you need a scan and you need a certain position for this, if the patient is not able to do that certain position, and you can take the same scan or the same procedure, you can do it in another way, doing any other way, you should employ that way only. So patient comfortability here matters. And second thing is, if we go for CT and MRI, like it's sir mentioned, claustrophobic patient, the patients which are having fear of these scans. Even myself, I am having fear of, I'm a claustrophobic patient when it comes to MRI. So when I have already gone 1 time, 2 times I have gone for MRI. So I'll be very afraid of the sounds and the machine and that all, entry and all. So the thing is, there also we should provide certain measures for this to make the patients comfortable. Like for one thing is, claustrophobic patient is undergoing MRI. That time you can provide one attender. Inside CT room, you cannot provide the attender. So in CT room, you can give the sedation. For MRI scan, for a CT scan, you can give sedation to the patient to do that scan. And in MRI, you can provide an attender inside the this gantry room, inside the modality room only, and there he will feel better. Because being alone, he will be afraid. But if you provide an attender with him, or if there is a staff nurse or any other supporting staff, you can provide that inside and you can do the scan.
Okay, so because like for managing the critical patients or the psychiatric patients, there's a different ways to manage them.
Common thing in the radiology, if you got like 10 cases a day, out of that 6 patients will not be cooperating. Like it will be, babies are there, like 2-year, 3-year babies will be there. They will never cooperate for the skin. So you have to deal with your own way. You have to console them. What usually, being a radiographer, what I will tell, when a 2-year, 3-year baby comes for X-ray, I'll take a photo of you. I'll on the collimator light and I'll show them, see, you have to stand there. I will take very nice photo of you. After that, if you pose nicely for the photo, I will give you a chocolate. Like that I will do. even though I did not give chocolates to the patients, but I will just, for the sake of the skins and all, I will just tell them. And there is a common term we usually use in radiology. We don't use, actually, I have myself have kept it. You pose, we expose.
You pose, we expose. Amazing. Amazing, sir. So I hope we deal with all the questions. And sir, like you both shared your experience, and that's really amazing, really appreciable. We have one small gift for you, sir. Sir, if you want to tell our audience anything, you can tell.
So I'll mention about sir. He has been my teacher. He has been my teacher since 2021. I was in my second year, and sir has a bright background in this field. Sir has pursued his BSc from Tamil Nadu, and he is gold medalist in his bachelor's. Along with that, sir has completed his MSc from Tamil Nadu only, and he has pursued a gold medalist in that also. Currently, sir is pursuing his PhD, and sir has sir has written one of the chapters in one of a book. Actually, sir is taking care of that book. Sir is dealing with that book, and in that, sir and one more ma'am is there, Miss Shobna. She is sir's junior. Both they have written one chapter related to MRI, that is spin echo sequences and gradient echo, and sir has mentioned in very detail. And currently, sir is working on another book also. So you will very soon see sir's achievements and all. And I'm very proud to be a student of my sir, Mr. Kasi sir. And I hope in future also he will be guiding me through other things, wherever I require him. And today, I'll tell one more thing here. I'll just try to add. Being a student, it's a proud moment for me that here I am sitting beside sir and discussing about the field which sir only taught me, or discussing about the things which sir only teached me till now. So it's a proud moment for every student. I wish every student gets this opportunity, and I hope that sir will take care of me in this field. He will take care of me until he will take care of me when until he is in this field and until I'm in this field.
Yes, definitely I will.
And I will just thank you sir for this for his guide, support, and all the things he has taught me, and that's because why I am here right now.
And thank you for inviting us for the program. This is our first podcast, and it is a nice experience. Thank you.
Sir, take this. So thank you with having us. Bye. Have a nice day.